vaccines. Now, one of the things I want to ask about is, are we going to talk about our flu clinic specifically? Do you want us to?
You could. What I would suggest is that you say, you can talk about your flu clinics and say people can also go to other healthcare providers or even...
I think the first question I'd like to ask, if you could explain for our viewers, what is an allergy?
So first off, our immune system is supposed to fight off any invaders that try to attack us. So things like bacteria, viruses, parasites. An allergy is actually when you have an inappropriate immune response to something that's actually pretty harmless. So something like a pollen or a food protein or a medication.
And does everybody have allergies?
Not everybody have allergies. It is definitely a common problem, especially in this area. So 40 million Americans have allergic rhinitis or hay fever. Also, a lot of patients who have asthma, food allergies, and we're definitely seeing an increased prevalence over the recent years.
And can you tell us a little bit, what is an allergist? What do you do that's different from a primary care doctor who takes care of allergies?
So as an allergist, we're specialized in the diagnosis and treatment of allergic conditions, so things like allergic rhinitis or hay fever, asthma, food allergies, medication allergies, hives, eczema, venom allergies, so anything involving an overreaction of the immune system to something that it shouldn't be reacting to.
So as an allergist, you take care of some of the more severe allergy reactions?
Yes.
And primary care doctors take care of some of the more common allergy reactions. What can our patients do for themselves before they have to see a doctor?
So if you know that you're dealing with allergic symptoms that occur, say, in the springtime every year, you can try to do some avoidance measures like keep your windows closed when you're driving around in the car, keep your windows closed at home, try to use your air conditioner in the house instead of letting the ventilation and the pollen sort of come through the house as well. There are definitely over-the-counter medications that can be helpful. So things like the nasal steroid sprays like Flonase, Nasacort can be tried, on your own before going to the allergist. Rhinocort will be coming over the counter shortly as well. There are also over-the-counter antihistamines, things like Zyrtec, Allegra, and Claritin, that can be very helpful for more of the drainage type issues. An allergist is, trained in testing, so the one thing that your primary care physician can't, really do is that skin test portion. So we can actually see you in clinic and do skin testing to determine what exactly you're allergic to.
So as a family doctor, I take care of a lot of patients with allergies, some of them very common, some of them not. And we talk a lot about things that my patients can do in their home to help reduce troubles with allergies, whether it's hay fever, or I know that a lot of people are allergic to dust mites and animals, things like that. So before we talk more about what the doctor does, could you help our patients understand a little bit more about things they can do in their home besides avoiding pollen?
Right, so if you're allergic to dust mites are actually microscopic little bugs that live in your bedding. They live in upholstered furniture. They live in carpeting. So if you know that you're allergic to them, you can try to take some measures at home. Specifically, washing all of your bedding in hot water every 1 to 2 weeks to try to kill the dust mites. There are also pillow encasings that you can zip around your pillow that try to prevent your exposure to the dust mite allergen. You can't actually get rid of the dust mites completely, but you can definitely minimize your exposure to them. Things like a vacuum cleaner that has a HEPA filter that you can use when cleaning your carpet can also be very effective. If you have an animal in your home, so a cat or dog that you're allergic to, HEPA air filters are actually very effective for removing that allergen. So we'll recommend, in addition to trying to wash the animal, which obviously washing cats and dogs isn't the easiest thing, but trying to wash the animal on a frequent basis, and also keeping the animal out of the bedroom can be very helpful.
I like that last suggestion. So both Dr. Cronin and I take care of adults and kids. One thing that's especially helpful for people with more severe allergies and children with asthma, adults with asthma, I think, is that you have an allergy-free zone. So if you just have to have a dog in the house, but somebody's allergic to that dog, make their bedroom at least a dog-free zone and keep it as clean as possible of dog dander. So the individual at least has somewhere to go to avoid the thing that causes troubles.
I definitely agree with that.
I like to recommend for people with hay fever that they have indoor clothes and outdoor clothes. So as soon as you come home, change clothes, wash your face, wash your hands, brush your hair somewhere where the pollen and everything will get off of you, and then put on clean clothes. Especially be careful to put your outdoor clothes in the laundry. Don't put them on your bed. That's really where you're going to spend a lot of time. And if you're allergic to something from outdoors, now it's in your bed. So you've mentioned that our patients can use over-the-counter antihistamines, which we use day by day to help control symptoms or every day if needed. Also the steroid nasal sprays, which are more preventive treatment, so they have to be used every day over a period of weeks to be most effective. And then if that's not working, what kind of tools does the primary care doctor have besides the over-the-counter treatments that patients might want to talk to their doctor about before going to see the specialist like yourself?
So there are also some prescription medications that can be used for allergies. Things like Singulair block a different pathway, so a different sort of chemical pathway that can cause inflammation. So that's something that can be tried, and that's helpful for both allergies and asthma. There are also prescription nasal sprays, things like the nasal antihistamines like Astelin and Patinase, that can be used in conjunction with the nasal steroid sprays and the oral antihistamines and be very helpful. There are also non-medicated treatments, things like flushing pollens out of your nose by using saline washes. For people who have, specific eye issues, they can also use some of the eye drops, some prescription, some over the counter, to help with some of that allergic conjunctivitis, we call it, so inflammation of the eyes just from the allergies.
So we've talked some about what patients can do for themselves, both with medications, adjustments in the home. We've talked some about what causes allergies. Let's get to allergy shots and testing.
Right.
That's really, I think, where our allergists help us a great deal.
Right. So allergy testing, when you come into allergy clinic, typically the expectation is that we're going to try to figure out exactly what you're allergic to. So our testing involves a series of scratches, which we usually do on your upper back. We're essentially scratching you with each individual allergen or thing that you could be responding to. So we do a series of scratches for tree pollens, grass pollen, weed pollens, molds, cat dander, dog dander, dust mites, cockroach, things like that. So we'll usually scratch a panel on your back, leave it on for about 15 to 20 minutes, and we can actually tell you right then and there what you are reacting to. The scratches are done with a little plastic applicator, so no needles involved in the initial testing, although occasionally we'll bring you back to do further testing that involves small little needles that we inject under your skin. So we can tell what you're allergic to. The same can be done for foods. So if we're concerned that you have a food allergy, we can also do those scratches for the various foods that we are concerned about.
So allergy testing is nothing to be afraid of, not too painful.
Not too painful. We usually tell kids that it feels kind of like a cat walking on you, so just sort of scratchy and itchy.
Okay. And is it dangerous?
It's not dangerous. We have you come off of your antihistamines for about 3 to 5 days prior to the testing. So oftentimes you're pretty miserable when you come into the allergist office for the first time. But the testing that we do, in addition to being relatively painless, is not dangerous at all. When we do testing for things like the venom allergies and the medication allergies, those tests usually take a little bit longer, and we go over some of the risks of reactions with those if we're actually going to give you a medication or give you a food during your visit to confirm or see whether or not you've outgrown that allergy.
And I know that at the Palo Alto Medical Foundation allergy departments, they're all located close to emergency services within our buildings, and all of them are staffed by trained nurses who work exclusively or almost exclusively with allergy patients and know all about how to respond, when to get the doctor to check on anyone who's having trouble. And all of our allergy physicians are highly trained to respond to any unusual reactions. Mm-hmm. Dr. Cronin's an expert. Now we know what I'm allergic to. What happens next?
So if you're allergic to pollens in the environment, we will typically go over a regimen that includes some prevention things like we discussed before, dust mite avoidance, pollen avoidance, animal dander avoidance. Talk about perhaps some recommended medications, maybe which seasons you need to be starting those medications to be most effective for you. As you mentioned earlier, the nasal steroid sprays do have to be taken every day to be effective. So if we know that you're going to start responding to something in March, maybe starting those mid-February could be helpful. And then we'll go over if none of this works, or if for whatever reason you don't want to be taking a daily medication, we also offer allergy shots. So allergy shots, not to scare anybody, allergy shots are a regimen of treatment that we come up with based on your clinical history as well as your skin testing results. So we can sort of tailor that treatment specifically for you.
And how often does someone have to get their allergy shot?
Initially, when you start the allergy shots, we give you a very low dose, essentially inject you with a very low dose of what you're allergic to. We inject this usually weekly, although up to twice a week for the first maybe 6 months. And then after that, we can transition you over to monthly injections. So during this time, we'll actually be increasing the dose slowly over time until you reach your target dose or your maintenance dose. And that's the dose that you'll continue monthly for about 3 to 5 years total. So it's a pretty long treatment course overall. The benefit of doing allergy shots, though, is this is the one thing that we can offer you that actually will change your immune system over time so that you will be less sensitive to those allergens that have been causing you so many problems.
So how does this work? I'm allergic to something,
Right.
and you're going to inject it into me.
I know, it seems crazy.
Yeah. How does that help things get better?
So thankfully we've been doing this for over 100 years. So it is a proven treatment regimen. But by giving you these small amounts of the allergen over time, we're actually able to desensitize you and make you tolerant of those things. So that each time you see this allergen, you've seen it so many times that your immune system actually doesn't respond to it like it did in the beginning as a foreign invader. It just kind of ignores it after a while. So some refer to it as more of a blocking antibody, but definitely the mechanism is that you don't react as much to those allergens anymore.
So you're just helping my body tune out
Exactly.
the annoyance of something I'm allergic to.
Right. So, and because we tailor it specifically for what you're actually allergic to, so it's essentially a prescription made exactly for your body.
Julia, we talked about hay fever and pollen, but we didn't really talk about what that means and what kinds of pollens are most common around here. Can you help our viewers understand more about that, please?
Right. So in this area, we unfortunately have a tree that pollinates pretty much every time of the year. So we always have a tree pollinating, which we're very thankful to enjoy this great weather, but because we don't have any freezing over, there's always some trees that are out there. So the most common allergen that really causes, the biggest issues in this area is the grass pollen. So grasses pollinate here between about March and July, although some species can continue until October, and they actually are pretty much prevalent everywhere. There are a couple of trees as well in this area, so primarily juniper, oak, and olive. Juniper tends to pollinate more December through April. Oak trees are in the springtime, March and April, and olive trees are a little bit later, May and June. And, various trees cross-react with other trees. So if you're allergic to any of those, unfortunately, you're going to be exposed no matter where you are. And then there are a lot of other trees and weeds and things like that that are more neighborhood specific.
So it sounds like hay fever and pollen allergies go on almost all year round.
In this area, depending on what you're allergic to, yes, you may have symptoms year-round.
And also people who are allergic to dust mites would be year-round too.
Exactly. Dust mite allergens in this area are also year-round.
Let's talk a little bit about other treatments. We discussed some medications, antihistamines, allergy nose sprays. But I know there are some commonly used herbal or non-medication treatments that my patients ask me about. I'm not sure exactly how well they work. Do you have any advice for our viewers about things like eating honey that is produced locally, or royal jelly, or other treatments that some people use for allergies?
Right. So we get asked that a lot as well in the allergy clinic. My, usual response is that, we really don't have any great clinical data supporting the benefits of those particular, interventions. But if they, are something that you want to try and it's something that seems to work for you, then, I'm not opposed to you giving it a try and seeing if you get some benefit from those.
So basically they're food, and we don't know if they're going to help too much or not.
Right. The honey that you mentioned as well, the pollens that tend to be spread by bees are the ones that are not actually the airborne pollens, and it's usually the airborne pollens that cause more of our symptoms.
Sure, I understand.
So I don't know how much benefit you would get from that. But again, many patients will try those and seem to notice some effect. So as long as it's not going to harm you, I'm okay with you continuing that.
Well, let's turn to other allergies that aren't pollen related. I'd like to ask some about food allergies. What are the most common kinds of things that people are allergic to that they might eat?
So the 8 most common food allergens are milk, egg, soy, wheat, fish, shellfish, peanut, and tree nuts. And that's a majority of what we see in clinic. Although we do definitely see other food allergies as well. So when we see somebody for a food allergy evaluation, we usually try to focus in on what type of reaction they've had to which food and really just do testing for those particular foods. The most common ones, obviously, we ask about. I see a lot of pediatric patients, so a lot of young children. So always asking about what's been given yet, has mom been nursing, and if she's been nursing, what foods has she been eating? So these are all things that we ask at our clinic.
What kind of reactions are common for people who have food allergies?
The most common food allergy reactions are going to be things like hives, so red big splotches that are itchy that develop all over the body or in certain areas of the body shortly after eating the food. Shortness of breath, wheezing, sort of asthma symptoms. We definitely see GI symptoms, things like vomiting, sometimes diarrhea after eating certain foods. Those are typically the most common reactions that we come across.
You mentioned that milk is a common allergy. How do we know the difference in an adult in particular, the difference between an allergy and someone who just isn't tolerant of lactose in milk?
Right. So lactose intolerance is actually a big problem in the adult population. So you stop making the enzyme that essentially helps break down milk. So a lot of the lactose intolerant symptoms are more GI symptoms, things like, bloating and diarrhea or, just GI upset, essentially stomach upset after eating milk products. The true milk allergy that we consider allergy antibody to milk, those patients typically usually within 15, 30 minutes up to an hour of eating the food will get oftentimes more the itchy rash and the trouble breathing along with perhaps the GI symptoms.
Are some of these reactions to foods dangerous for us?
So reactions to foods can definitely be dangerous. Unlike the reactions to pollens that tend to be more with the respiratory system, with the sneezing and the itchy eyes and the runny nose and the nasal congestion, these symptoms can actually lead to dizziness, loss of blood pressure. You can go into something called anaphylaxis where you actually do, essentially your blood pressure falls and you may need to have life-saving treatment with something called epinephrine, which is essentially an injectable adrenaline.
So it's good to know if you're allergic to some of these nuts or other foods. Please tell me a little bit about how the epinephrine works. What do patients do for themselves, or what should they be aware of if they have food allergies?
So if you've been diagnosed with a food allergy, the recommendation is to avoid that food strictly. So to make sure if you're allergic to peanuts that you don't eat any peanuts, any peanut-containing foods. Now this can obviously be difficult with parties around the holidays and things like that when you're exposed to things that may be mixed into things or baked goods that you may not know exactly what's in there. If you know that you have a food allergy, we recommend that you keep some form of liquid Benadryl on hand, which you would use for a mild reaction, so something just, little bit of itching or hives. If you have a more severe reaction, though, we recommend that you also be carrying an EpiPen, which can be prescribed by either your regular physician or an allergist. And that EpiPen you should have access to at all times, and it can be life-saving if you have a severe allergic reaction.
How does an EpiPen work?
An EpiPen works, so it's adrenaline, so it essentially works by tightening up all of those blood vessels. I mentioned that you can have sort of the loss of tone in all the blood vessels and your blood pressure falls, and this is something that actually sort of tightens everything back up, has effects at other areas of the body as well to sort of reverse some of those toxic effects of the allergic reaction.
And are they hard to use, these EpiPens? Can kids use them?
Kids can use them, so we do train the parents when we see young kids in clinic. I normally, if you have a child who's in elementary school or something like that, I normally have the EpiPen administered by somebody else, like a school nurse, if there is a reaction. But they're pretty easy to use, so you essentially just take the EpiPen itself and, we recommend that you inject it on your sort of outer leg, so your upper thigh or thigh muscle. Hold it for about 10 seconds, and then you can release. If you do have to use the EpiPen, though, we recommend that you either call 911 or seek emergency medical care. You may need a second dose within 5 to 10 minutes, and you definitely need to be evaluated by a medical professional.
So some food allergies can be dangerous, but also I know that some people are allergic to bees and wasps and things like that. Do you see those folks too?
We do, actually. So we see definitely people who've had any type of reaction that they're worried about, an allergy to bee, a honeybee, a wasp, a hornet, yellow jackets. So we do a series of testing, somewhat like our skin testing that we do for patients with hay fever and food allergies. This testing is a little bit more intense. It involves a little bit longer of a procedure, some scratch testing as well as some testing with small needles, just injecting little bubbles of the venom under the skin. And funny that you mentioned that too, so we actually do allergy shots for venom, which a lot of people actually don't think about, but that is one of the things that we actually use allergy shots for as well.
And can you use allergy shots for things like poison ivy and poison oak?
No, so poison ivy and poison oak are more in the category of contact dermatitis, so where you come into contact with something and you get a rash. So allergy shots unfortunately don't work for things like that.
We spend a lot of time talking about allergies, and you're an allergist, but I know that allergists take care of more than just allergies. I don't think we have time to go into detail about some of these other troubles today, but if you would please help our viewers understand what other kinds of troubles that patients may have might their primary care doctor recommend they see you at the allergist office for?
So allergists are also board certified in immunology. So we also see patients who have trouble with their immune system. So we talked about allergy being sort of an overreaction of the immune system to things that you shouldn't necessarily react to. But we also see patients who have recurrent infections, perhaps issues fighting off certain types of infections. Anyone with an immune deficiency, we also do evaluations for that. We will sometimes recommend treatment for patients with immune deficiencies as well. So it's something that we also evaluate and see in our clinic as well.
So a lot of kids have allergies and asthma. Are they stuck with those for life?
Not necessarily. So thankfully, a lot of the food allergies are actually outgrown. So we oftentimes will tell parents that milk and eggs are typically outgrown, not everybody, but typically outgrown by the age of about 5 or 6. Unfortunately, 20% of peanut allergic kids will outgrow, so it's not that high, and only 10% of tree nut allergic kids actually outgrow their tree nut allergies. In terms of asthma, we do oftentimes see improvement as kids get older. There's definitely a fair number of kids who wheeze when they're young due to viral infections, and as they get older, we just don't see that as much anymore. A lot of that is based on the family history, whether or not they have a parent who has asthma or not. And allergic, sort of things in the environment that you may be allergic to, we do sometimes see that change over time. Moving to a new area of the country, for example, it can take a couple of years to develop new sensitizations. So you may feel like you've moved to a great new area and then unfortunately develop symptoms a few years after living there.
And other than people who have allergies in one place and then move, how often is it that adults develop new allergies?
We do see adults develop new allergies, not as common unless, of course, you're someone who's getting exposed to a new environmental thing. You get a new cat or dog or rabbit or something like that. But we do definitely see a fair number of people show up with what's called non-allergic rhinitis, which is more triggered by irritants, things like smoke, strong odors, barometric changes, so weather changes, cold air, hot air. We definitely see more of that as patients get older.
So as you can understand from our conversation today with Dr. Julia Cronin from our allergy department here at Palo Alto Medical Foundation, allergists take care of all kinds of troubles. They help all of us with dealing with the discomfort of hay fever and other kinds of allergies. They help some of us who have more serious medical problems and help make our lives safer by using treatments for dangerous reactions. And then also help some people who have chronic illness related to the immune system. So most of us will probably start with questions for the primary care doctor about things bothering us, but it's important for everyone to know that we at the Palo Alto Medical Foundation have a wide range of specialists who can help with any of your needs. So ask your primary care doc if it's important to see an allergist for the troubles that are bothering you. Thank you for joining us today on KCAT Television, Health Connections. I'm Dr. Stuart Menakar from the Palo Alto Medical Foundation. Bye-bye.